Hi, everybody. Good afternoon. Wanted to jump on here real quick and just talk about the coronavirus and some of the things that are going through our minds, our hearts right now. Last 4 months or so, we've been living with coronavirus, and I say that, it's probably only been in the last month or so, or maybe even the last week or so, that we've really come to terms with the fact that we are now living with coronavirus. It's going to be here for the indefinite future. We don't know how long we're going to be really living with the coronavirus. So what do we do? How do we understand this? What does it mean? How do we contain or maintain a healthy respect for the coronavirus without being overwhelmed with fear and panic? And just trying to navigate, what life with, this virus looks like. And from our perspective as a church, what do we do and how do we manage that? So there have been, an increase in cases in Mercer County in the last week or so. And one of those cases is somebody from First Baptist Church, and they attended our worship service on Sunday and then found out later in the week that they were tested positive for coronavirus. And so we're trying to figure out, okay, how do we, manage this? How do we deal with this? How do we, get information out to people and appropriately and that kind of thing. And so we've been working hard at that, trying to, figure out how to be the church, how to continue to minister to folks in, this whole situation. And by God's grace, He's allowed us to continue to have a great platform and a wonderful reputation to get the gospel out to people. Part of that is what we do in worship. And so we are committed to worshiping together, but we also don't want to put anyone at risk. And so how do we continue with that? And our thoughts, our plans are that we want to just make sure that people are really encouraged that if they have any symptoms at all, that they would just stay home, stay away from group gatherings. And obviously, of course, we're talking in context of our church worship services. We live stream, we have it on Facebook, we have it on YouTube, we have it on WRMJ radio. So there are many, many ways to continue to stay in touch and stay involved without being here. And I hate to say that as a pastor, you always want to bring people together in worship, and hardly ever would you say don't come to worship. But we want to be respectful and we want to be careful. And so we just encourage you, if you have any symptoms whatsoever, please stay home. And then also, if you're at all at risk, if you have any immune issues, if you have any health issues at all that put you at risk, then please stay home. We love you so much. We don't want to see anything happen to you. And so as much as we would love to have you together in our body, we know that you're still part of our body, even if you're at home. And so what we're doing and what we've been doing and we're committed to doing is to be safe, to sanitize as best we can. And here are just some of the things that I wanted to share with you about what we're doing as a church to continue to be safe and to be sanitized. But before I do, real quick, I want to explain really quickly the difference between first-hand exposure, second-hand exposure, because I think there's maybe a little confusion about it, or even third-hand and fourth-hand exposure. But we're just going to deal with first and second-hand exposure. First-hand exposure is that you have personally come into close contact with somebody who has tested positive with coronavirus, okay? First-hand exposure. And if this is the case, if you've come into contact with somebody who has been exposed, then you need to alert people to that fact, that you've come into contact. It doesn't mean that you're contagious, doesn't mean that you have it, but you just need to be aware that you have come into contact with somebody. But first-hand exposure, if you are the person who has tested positive with coronavirus, then you need to contact, if you're part of our church body, okay, I'm not talking about everybody everywhere, I'm just talking about our church people, need to contact the church office, let us know that you have been tested positive. Let us know if you've been in a group or our worship service, when you attended, that kind of thing. And then when did you become symptomatic? Because we understand and believe that you're not contagious if you're not symptomatic. Okay, now if I'm wrong about that, I'm sorry, but what I understand is that if you're not symptomatic, you're not necessarily contagious. So that's an important distinction to make, that when you became symptomatic is an important thing that we would like to know. When you were tested, when you came up positive. We need to know those things, so please let us know that. The infected person should, and you're going to contact the health department and all those things anyway, so, but they're going to recommend you stay home. In fact, they're going to really ask you to stay home for at least a week and those kinds of things, and take care of yourself and that kind of stuff. So the infected person is going to stay home, and then the church will determine how to, let people know if it's a group or if it's a worship service or whatever part of the body they were involved in, to let the church body know that there's been a positive case, and just be aware of that. That's first-hand exposure. Second-hand exposure is when somebody is exposed to somebody with coronavirus. They live in that same household, and they've been in a group or in a worship service, but the infected person was not. So it's second-hand exposure. They're also going to be asked to be quarantined by the health department. So they're going to stay home. And then the secondhand person is going to talk to, out of respect for the people around them, the fact that they have been exposed to somebody with coronavirus, and if they've been in close contact, just for their knowledge and safety, that these are things that we need to be aware of that are going on in our community. But a secondhand person, according to my understanding of what the health department wants to see happen, is that the secondhand exposure needs to be careful and respectful, just like we all need to be, but they're no more contagious, or they're not spreading the virus any more than a healthy person who doesn't have it. So we don't need to be panicked about that. If there's a secondhand exposure, we just need to be aware of that. But the church body, what we're doing, what we've been doing, what we will continue to do, is we are going to limit our sizes in our groups, in our classes, our worship service to 50% capacity in any space. So any space that people are meeting in, that room is not going to be maxed out in capacity. It's going to be 50% or less. We're going to limit physical touching. So we're really asking, we haven't really been asking this so far. We kind of want people to have the freedom to do what they feel comfortable with. But at this point, we feel it's necessary to ask that there's no touching. That even if you're comfortable shaking hands, please don't shake hands, don't touch, don't hug. We hate that. We know that people want to, shake hands and hug and those kinds of things, but we just really shouldn't be doing that right now, okay? And so we're going to ask in our church body that we don't do that. We're going to say that masks are recommended. And the understanding of masks is that if you did have the coronavirus, didn't know it, and you were wearing a mask, you're very much less likely to spread it. So it doesn't keep people from getting it necessarily. You don't put a mask on because you're not going to get it. You put it on because you're protecting other people from anything you might have. And so we're going to just ask that, or just recommend that you wear a mask in our spaces. And again, it's up to you. We're not going to require it, but we're just saying for your own self-interest and safety, it is recommended. We take the temperatures of our children and our youth and our volunteers when they come in. So we're doing that. We'll continue to do that. And anybody who has a greater than 100-degree temperature is going to be asked not to participate. And so in those small spaces where even though we're 50% capacity, it's hard to physical distance the way that we would want to. So the household is asked to not participate for that event if there's a temperature that is higher than 100 degrees. And then we're going to start dismissing and worship services by rows. So when you come in, the bulletins will be available. Nobody's going to pass them out. They're just going to be on a table. You can take one if you want one or leave them. And then after service, we're going to dismiss by the back, row by row. So our ushers will come by and they'll dismiss you, just to kind of limit the number of people trying to get through the door at one time. We're sanitizing all of our spaces in between groups and worship services. So we have people, our staff and our volunteers and our ushers are going around with sanitation wipes and wiping down hard surfaces. We have a spray that we spray on things that we can't wipe down and to disinfect. So we're disinfecting constantly. Obviously, we have hand sanitizer everywhere all over the building. So we're asking people to sanitize their hands all the time. And then another added thing that we're going to do is we're going to begin to add an air purifier to our sanitation process. So after Sunday morning, sometime through that week, we will come in with an air purifier and purify the air. And so that'll be another added thing that we're going to do. And, again, I just want to tell you that we are so thankful that the Lord has been so good. In all 29 cases that we've seen in Mercer County, there have been 2 hospitalizations and 0 deaths. And so we take this seriously, that we have a healthy respect for the coronavirus. But again, this is not something that we are panicked over. We just have to learn how to live with this, how to continue in life with some different kinds of processes and procedures and how we do things. We're being wise and we're being safe, but we're also trying to get back to what normal life is, and it's social and it's together and it's worship and those kinds of things. And so we're committed to doing that. We're committed to trying to keep everyone safe. And so we appreciate that if you're concerned, if your health is at risk in any way, or if you have any symptoms, please, we want to make sure we have as much availability online streaming that we can. But if there's any concern or risk at all, please just stay home. And we love you, and we'll see you soon. But for now, these are the things that we need to be doing. And so just wanted to kind of update you on all those things. I wish it were a more upbeat and fun thing that we could get into this morning or this afternoon as we're online, but that's what we needed to deal with today. So thanks for joining us, and we'll be sending you a letter. If you're on our mailing list, we'll be posting a physical post on Facebook that is going to give you an outline of the things that we're doing so that everybody can see kind of what's going on and how to continue. Okay, we'll see you later. Thanks.